Hey, Michaela Cosand, therapist, video demonstration. Hi, Alyssa. How are you doing today?
I'm good. How are you?
Doing pretty good. Thanks for asking. How have you been since we last spoke in terms of school stresses and family?
I've been okay. I definitely think I'm still experiencing like those panic attacks, like I had said, just like that elephant weight on my chest. I still am like experiencing really sweaty palms and feet and just like that shortness of breath where like I feel like I can't breathe has just been very frequent happening every day. Um, and it's starting to like be in like before it was just like at night, like when I'd get home it would like kind of start like once I like started to lay down for the evening, I would start to like feel that like I can't breathe feeling. And then I've noticed like since the last time we met that it's starting to happen like in the morning. And even like earlier this week, it happened when I was in lab for one of my classes, which is like the first time that's ever happened. So I definitely like have noticed it starting to get worse.
Okay. So it's starting to kind of impact other areas of your life or other times of the day.
Hmm.
Yeah, so I know we went over this a little bit in the intake session, but I just wanted to get a little bit more information about kind of when these feelings started and what, if any, might have been a contributing factor. I know that you mentioned that school and studying for the MCATs has been really stressful for you. Um, but can you tell me a little bit about when you first started having these panic attacks? Kind of what was going on in your life at that time?
Yeah, I think I am just like burnt out of school. I'm so tired all the time and just like have no motivation to like want to do school. And I think that's just because I've not been in it for so long, but it's just been so rigorous for so long that it has just become like an overwhelming weight. Um, yeah.
That's a lot of pressure
Mhm.
to maintain that for, and then, with the anticipation that you're going to continue in med school, I feel like, I mean, speaking of pressure on your chest, I think that that's metaphorical, but,
Mhm.
that's a lot of pressure to have. So,
Yeah, and I've just been like really contemplating like if it's something that like I really want for myself or if it's something that like I feel like it's an expectation my parents have for me or like society has for me that I feel like I have to like fill this role and I like can't tell if it's like for myself or if it's something that truly interests me because I definitely enjoy like all of my classes and like what I'm learning and what I want to get out of it, I definitely like, but I also have just been like struggling with like, okay, is this really what I want for like me and like my future? So I've just been like struggling with like those thoughts.
yeah, well, I think that's really insightful that you're thinking about that and trying to make that distinction between what's important to you and maybe external pressures that you're feeling. So, I think that's really good to think about. Speaking of your parents, I did want to ask you a little bit more about your relationship with them and your family life. Are they supportive? I know that you said that maybe this is something that they want for you as well.
Oh yeah, like my family's very supportive of like therapy and everything. I definitely am like not interested in like taking any medications. I definitely prefer like a more like holistic approach, just to like coping with my anxiety. But I am like very close with my family. I would say I'm like super close with my two sisters. I have a really good relationship with them. They're both older than me. But like one still lives at home. So like when I go home for breaks and stuff, like I'll see her and we'll hang out. And like I talk to them like every single day. And I'm super close with like my parents. Just been like really having a hard time with like the fact that like my dad's sick and like I feel like he's just like the glue of our family. So I've just been having a hard time with like knowing that he's sick and like what could happen and like what could come of it. And I just kind of like feel like that is like also causing me just a lot of stress, like wanting to like I just have like a desire to be home more often and like so I feel like distracted while I'm at school.
Yeah.
Um so yeah.
Yeah, well, I think, yeah, that's gonna occupy a lot of your thoughts, understandably so, and maybe some uncertainty, about what the future holds. So I can understand that that would be difficult to focus in classes with all of that
Mhm.
to think about. Um, when did you find out about your father's diagnosis?
It was about 2 months ago. He has had cancer before, like when I was younger, when I was like 10 and 11. I remember him like going through chemo. It was super early stage and they were able to get it. So like we knew it was a possibility that it could come back eventually. Like it was like his like annual like scan that he was going to that they like found the cancer again. So it's just like overwhelming and defeating that like we're back here and like it's worse than it was before. But like we're all trying to just like stay positive. But it's just like so hard to like see him going through chemo and like trying to stay positive, but like you can also just like slowly like starting to see the life kind of like leaving him. Like he's super pale and like starting to lose weight. So it's just like really hard to like be motivated and want to focus on school when I just like have the desire to like be home and be near family.
First and feeling like, yeah, you want to be there for not just him but for the whole family. I mean, I heard you say that he's like the glue of the family, so I wonder if maybe you're feeling some pressure to try to fulfill that role as well, in addition to all of your other.
Yeah, and I feel like it's like coming out in like a form of like self-sabotage where like I know I have stuff I need to get done, but like I just like have been like lacking motivation to like get it done. So like I'm either doing it like super late at night or like super last minute. And I definitely think like that's not like helping with like the anxiety that I've been feeling. And that's why I just felt like it was time to just get into therapy to be able to like process all of the thoughts and emotions I've been feeling for the last few weeks. Cause I would say like the panic attacks started maybe like a month ago, like 3 weeks ago, and they've just been like consistent.
Right.
And so I'm like motivated to like want to get like a hold of like my emotions and just like how I've been feeling and like really work on like self-care and like taking that on and like seeing what that looks like and seeing if that will like help me
Right.
feel more settled. So
Yeah, I think, just from our couple of brief sessions so far, I get the sense that you're a really self-aware person and that you spend a lot of time kind of thinking about those things. So I think that's a great strength to have, especially when you're dealing with so many difficult things as you are right now. And I heard you talk a little bit about self-care. Are there things that you do now or that you've tried in the past, kind of in that vein of self-care and trying to feel more grounded?
um I haven't really started doing anything yet. I have like thought about like maybe journaling or like getting some like bath bombs and like taking baths like at night when I get home as like a sun like to like try and like decompress and like de-stress. Cause like I've noticed that it like that just like elephant weight in my chest and like that shortness of breath kind of is like more evening dominant. And so I feel like adding in like a nighttime routine or like just little things like that will like help like distract my mind if that makes sense.
Yeah, yeah, of course. I think that's a great idea, and that's something that I have been kind of starting to think about. Things you could try, maybe also some breathing exercises, or meditation. Have you ever tried anything like that before?
I haven't, but I'm definitely like open to the idea of it. I haven't really like looked into like meditation and like what that looks like. So
Okay. Yeah, I could definitely send you some information about that. I can email you some different, maybe if you wanted to start with some breathing exercises. Sometimes people with pretty severe anxiety can find that those help to calm them down in the moment when they're starting to feel that anxiety. Another thing I wonder if you'd be willing to try, because I know that you mentioned journaling, is maybe trying to keep track of when you start to have those anxious feelings, maybe what's going on in your mind and those physical symptoms that you're feeling, so you can kind of start to track, what might be affecting that anxiety or making it worse or better, and keeping track of the self-care things that you're trying as well.
mhm, yeah, I agree. And my boyfriend has been like a huge support in all of this. Like I'm really glad that like he's here like on campus with me and has been just like a support like through that because like he's really close with my family and like kind of knows everything that's been going on. So that's been
Yeah.
hopefully.
Great. I'm so happy to hear that, especially that, he's close with your family as well. I think it can feel overwhelming to try to explain to someone who doesn't understand, the intricacies of your family life and experiences. So that's great that you have him as a support. And your friends that you live with in your apartment are also supportive.
Yeah, I've been friends with them for a really long time. We actually all went to high school together and all like applied and got in and have been living together since like freshman year. So they
Great.
like know me, they know my family. So it's been like really helpful, like having them be there to like help me
Yeah.
like through the process, just like feeling like hopeful, like when I'm like down and sad over like my dad having like a hard day at chemo or just like missing home and feeling homesick. I definitely have like felt a lot more homesick than normal. Like normally on the weekends, we'll like go out to like the bars and like party and stuff. But the last like couple weekends I've been like going home and like just being home with family.
How far away is your family where you're living currently?
They're like 45 minutes away from where I'm at, so not too far.
Right. Do you have a vehicle to get there when you go to visit or?
Yeah,
Okay.
I have a car here on campus that like I'll take back and forth. Um,
And
so
then
yeah.
oh, I'm sorry, go ahead.
Oh no,
Sorry about that. I was just gonna ask you about, so the past couple weekends, you said you've been going home to stay with family. Do you feel like that's been, do you notice, I guess, any change in your anxiety level when you're with your family versus when you're living on campus?
yeah, I definitely feel less anxious, kind of like less of that like depressed mood. Cause like I think like one of the big reasons like I wanted to like get into therapy was just like one, like as a form of self-care to like keep myself accountable. Because I just like have noticed like over the last like week I've lost just like a ton of like energy. I've been like feeling like very high some days and then like very very low other days, and so like I can just like feel like a cloud of depression creeping in, and I think that is like rooted in like the anxiety that I've been feeling and just like the downness I've been feeling because of it. So I think that like being home has helped me feel like less overwhelmed and like more connected with family, just because like I feel like I'm in such like a weird limbo season of like navigating like what I want out of life. So
Yeah, you have definitely a lot on your plate right now. And I think that, you know, you're doing a really great job of trying to manage all of that. But I think that also it shows a lot of strength that you're able to, um, about coming to therapy and talking to your support systems, because you recognize, that you are maybe seeing some symptoms of all of that stress that and concerns that you have right now. I wonder, you said that your energy level is kind of going up and down. And I know that you said that the anxiety tends to be more strong at night. What has your sleep schedule been like since you started experiencing that anxiety?
honestly, my sleep schedule has been like all over the place. Like there are some nights when like I'll be able to like lay on my phone till like 2, 3 a.m. because I just like am awake and have like no desire to kind of fall asleep. And I don't know if that's because like I'm on my phone, so that's like keeping me awake. But and then there are other nights like where I'll like intentionally take like melatonin gummies to like help me fall asleep because I know like I'll have like a really busy day and like I'll need like a good night of sleep. So it has just been really hit or miss my sleeping pattern. So I feel like during the day I felt like more like lethargic and like fatigued normally than I can normally am.
And I know that you said that sometimes you like to go out on the weekends. Is that something that you usually do if you're not visiting family?
Oh yeah, I really enjoy like being around friends, going out and just like living up like the college life.
Right. Does that usually keep you up pretty late on the weekends?
Yeah, I would say that it does. We normally will like get back around like 2, like 3, 4 a.m. But like I feel like I recover like well from it and it's not like doesn't like affect like my sleep where like I feel like I've been like off. in my sleep patterns,
Like more
like as of
general.
late.
Okay, so you don't feel like the going out and drinking is impacting your sleep schedule or any of the anxiety that you're.
No. Mm-mm.
I did want to ask you about any experiences with anxiety that you may have had when you were younger, or was there any other times in your life where you felt similar symptoms of anxiety that you've been feeling in the past few weeks?
I don't think so. Like nothing that I can like pinpoint from like my childhood. Like I remember that like the feeling of like being short of breath, like just from like doing sports. I didn't know if it was like asthma related, but this is definitely like a new experience for me, like experiencing anxiety. Like I've had like situational anxiety before where it'll be like related to like a test or like before like a gymnastics performance or something, but it would never um where it like affected like my day-to-day tasks, where now I feel like it is starting to like intrude on like my studying habits or just like my like getting up and going to class. Like I feel like I've been way less motivated than I normally am, and some like school is something that does motivate me, so I've had like a hard time navigating like a feeling of like not wanting to do it.
Yeah, but I can imagine that'd be really difficult to have something that usually motivates you suddenly not really fulfilling that role. Is it something that you've been able to discuss with any of your professors, extensions on assignments or anything that you might need to help support you through this semester?
I actually like haven't even thought about that. Like I'm not one to like ask for an extension. I'm one to kind of more just like bite the bullet, get it done. And I think like I have like a hard time with like asking for extensions or really putting myself first. But I think like that's something I really want to work on. Like I think it's okay to like need an extra day or two, like if I just have like a lot going on one of the days. So I think that's something I do want to work on is like reaching out and just like being transparent. Like with my professors, there's just like so many like students that they have. I feel like it's not even like worth bringing up or mentioning, but
Yeah.
um, definitely think that's something I should look into.
So you feel like because your professors have so many other students that maybe that's not something that they would want to focus attention on?
Yeah, I feel like a lot of it's just like really cut and dry. Like you do the assignment, you turn it in, like you go to class, you listen to the lectures. So I just like have never thought about like the idea of accommodations or like letting the professor know like, hey, I'm going through this like personally. Um, like can I get an extension? So
Right.
I definitely think that's something I like want to look into.
Okay, yeah, I think that just and also recognizing that maybe that's something that you've found challenging in the past, but from
Mhm.
everything that we've talked about, you have a lot going on right now. Your father being sick and having to watch him go through this, for the second time, and all of the anxieties and uncertainties that that brings for you and your whole family. And I hear you say that you're having some questions about what direction you want to go in for school and whether or not you really want to pursue medical school or if that's something, and maybe you haven't had the time to think about that as much with everything else going on. So I definitely think that if you do need to reach out to your professors for an extension, that that's something that could be helpful to you right now. And it's also something that if you ever wanted me to write to anyone, not mentioning anything specifically, but just that, you're in therapy and that you might need some extensions, I'm happy to do that. Totally up to you.
Yeah, that would be super cool. I actually like didn't know that that was like a thing or that you'd be able to like help me with something like that. So I definitely will probably take you up on that just because like I had like struggled, like I said, just like waiting to like do things like super last minute or like um if I am like able to like use like the resources I have, like I definitely want to do that because
Yeah.
I've just been feeling like additional stressors in my life and I feel like I've had like a hard time like controlling my thoughts. I feel like my thoughts have just been like racing frequently, and it just like causes me to like feel like a sense of like just like shutting down. So definitely something I like want to work on.
Yeah, definitely. I hear you saying that shutting down, and then I know you mentioned maybe some self-sabotage too. So I wonder if these, all kind of related, where maybe your anxiety is making you feel less motivated for school, and then, being less motivated is making it more difficult to finish things, which could be contributing to the anxiety. But I think that you're doing a really great job of piecing these things together and kind of noticing where you might want to focus attention.
Mhm. Yeah.
And then, oh, I'm sorry, go ahead.
Oh no, I was just agreeing with you.
Sorry about that. I just wanted to ask if you could walk me through. I know you said it's starting to happen in the mornings and it happened in one of your classes recently, but when this first started, I wonder if you could walk me through like a typical night where you said you're coming home from classes and then you start to feel this anxiety, these racing thoughts that you're having, or when you're having this anxiety. Could you tell me a little bit more about how that kind of goes for you?
Yeah. So like for example, like the other night, I like got up in the morning, went to class, like felt normal, felt fine, like throughout the whole day. And then like got home from class, then I like got ready to go to the gym. And like when I got home from class, like I felt like unmotivated. I didn't really feel like going to the gym. I didn't really feel like doing anything. I could like feel that like shutting down like feeling coming over me, but then I just like pushed myself to like go to the gym. So like went to the gym, just like worked out like on the treadmill, and then got back, and I just like have like that feeling of like I know I have stuff to do, but like I just like laid in bed, and then like I noticed like as I was like trying to relax and kind of just lay down, that like shortness of breath started to happen, and like a hard time breathing. And then I just felt really restless and like not agitated, but I just felt like I couldn't sit down. Like I just like was like pacing around my room, like trying to like figure out like why I wasn't like having a hard time breathing. And so I just feel like it's like my body physically reacting to just like the stress I have like bunched up in me. I don't know if that's like possible.
Yeah.
But
No, I was gonna say definitely sounds like this is a lot of physical manifestation of some of the stresses that you're having lately. Um, and you said that right before this happened, you also were exercising, or
yes,
this
then I like
time.
didn't know it was related to that. So
Yeah, I wonder if that has any relation to it. I know sometimes people find that exercising can help their body feel kind of relaxed or tired up, and so that they don't feel as anxious. But I wonder if it could be having a different effect for you. Um, when you're feeling that those physical symptoms, do you think that, I guess, how do you feel that the physical symptoms of anxiety are impacting your thoughts then? Do you think that that's kind of contributing to that cycling of thoughts that you're having?
yeah, I definitely think that like because like when I have a hard time breathing, like that's all I can think about. And so like my thoughts start racing. Okay, like why can't I breathe? Like why is this happening to me? Like why am I experiencing this? And then I just try and like am like trying to figure out like what's wrong. And so it just like becomes overwhelming. And I think like my boyfriend has like been coming over like when I have like episodes like that, and I think like having him be present and like know like if something were to happen like he's there has been like helpful, and like has helped me like feel like more calm.
Yeah, great. That's great. I was thinking that one of the things that you might do is keep a list of kind of creating like a toolbox of things that you can turn to when you're feeling like this. Because I know that you said you're looking for more of like a holistic um, treatment for this anxiety. And I think that maybe, having somewhere to turn when you're feeling like that, what are the things that you can do that have shown you in the past that they've helped. So maybe we can start trying to introduce some things like these breathing techniques and some mindfulness meditation, taking a bath, going for a walk, things like that, and keeping track of which of those might have a positive impact. And then maybe if things make it worse, I guess I'll ask you now, do you notice anything that does usually trigger it or make the bring those physical symptoms on?
I think like class assignments and like just like like the demand of school has like been like a really big trigger for me. Um, and I don't know if that's just because like I have so much going on in my personal life that I feel like school has just become like this extra weight. But yeah, like I've noticed like a lot of it can be like school induced or like assignment related. So I think like maybe finding a new like organizational system to like help me might be beneficial. But like that's why like, I wanted to get into therapy so like I could learn like breathing techniques or like find different ways to cope, just because I like am such like a frequent like person who works out, and so I just kind of like have known like that isn't like an outlet for me anymore. So
When you say that, is that something that you're not doing anymore, or you're just not finding that it's helping with the anxiety?
I'm just like finding it's not helping with the anxiety. Maybe if like I've thought about like doing more yoga and like breathing class like yoga or like a slower like meditative yoga, I think might um be like a good thing to try.
Yeah, absolutely. And I'm happy to look into that and see what resources for that kind of yoga classes, or even maybe some like YouTube videos that you could try on your own before you sign up for a class. I'm happy to do that if you'd like.
Yeah, definitely.
Great. Well, we're just about at time for today's session, but I just wanted to ask you if there's anything else that you wanted to go over today, or any questions that you have about anything we talked about.
No, I think I'm feeling pretty good as of right now. I definitely am glad that like I can reach out to you if like I feel like having like you talk with my professors like with me will help me feel like more validated and like more like I'm not just like being lazy and not just like asking for an extension. So yeah, that's helpful.
Yeah, absolutely. Anytime that you feel like you want to reach out to any professors, or if you'd like me to write a note, whatever you feel most comfortable with.
Mhm.
And I do want to just validate that you're going through a lot right now, and it sounds like school's always been really important to you. And so I think that maybe you do have this feeling that like by asking for any sort of help, you're not um, maybe like achieving that standard that you've set for yourself. But I think maybe if you start to look at it as in this way, that you are helping yourself to achieve what you need to in school by paying attention to the signs that your body is giving you, that maybe you need to slow down or take things at a different pace.
Yeah, definitely.
All right, well, thank you so much for meeting with me. Please reach out if you need anything before our next session. And I'm going to send you an email with some breathing exercises and some information on maybe meditation or yoga. And if you'd like to give that a try before our next session, and maybe keep some notes of how things are going for you, and we'll go over it then.
Yeah, perfect. Awesome. Thanks so much.
Of course, thank you. Have a great day.